This video will show proper technique for insertion of a Foley catheter. Please be sure to complete the following steps prior to starting the procedure.
I have assembled my equipment. This is the Foley catheter tray currently in use at Firelands Regional Medical Center. I will proceed to open up the outer plastic covering, removing the tray. I will use the plastic bag as a trash bag and place it at the end of the bed. I will then take my tray, I will set it between the patient's legs, reminding the patient to please not move their legs. I will then proceed to open just the first 3 sides, again only touching the outer inch of the paper protectant. What I will find is the sterile drape that I'm going to place under the patient, only again touching the outer inch. I will put the shiny side down, ask the patient to lift her buttocks, and I will place the drape under the patient. I then have Castile soap towelettes or wipes that I will use. I will open this packet up. I will place it on the bed. I will find the meatal opening, take the first wipe from top downward, and I will perform pericare. I will take the second wipe. I will do the same on the other side of the labia, and with the third wipe, I will wipe straight down the meatus, and I will discard. What I will do then is remove my gloves, and I will utilize the antiseptic hand rinse that is provided with the packet, allowing that to dry. I will then proceed to open the 4th side towards me, and I will remove my sterile glove packet. Opening both sides of the paper. I will first place first glove onto my dominant hand. I will then place the second glove. Being sure to keep both sterile. I will then proceed to lifting my fenestrated drape. And I will carefully place that over the patient's thighs so that I'm only exposing the labia, only touching the insides of the drape so I remain sterile. What I can do then is I can separate the tray that's on top from the box. I will remove the plastic covering from the catheter, being careful to not allow the catheter to touch anything. I'll lay that back in the box. And I will then take my syringe with my sterile water. I will take the cap off, and I will place that on the balloon port of the catheter. And I will lay that carefully back in the box. I will then open the syringe with the sterile lubricant, and I will spread that into the tray. For the sake of our purposes, I will actually be lubricating with a lubricant that is safe for our mannequin. I will then proceed in cleansing the meatus with my 3 iodine swab sticks that are provided. We'll tear open the packaging, and I can lay it there because again I'm totally sterile. What I will do now is I'll take my non-dominant hand and I'm going to spread the labia so that I can visualize the meatus. This non-dominant hand is now not sterile any longer, so I need to keep that in place throughout the remainder of the procedure. I will then remove one of the swab sticks and I will cleanse just as in the pericure from one side of the labia on downward towards the anus. I will discard. I will get my second swab stick. I will proceed down the other side of the labia, and with my third I will go straight down the meatus and I will discard. What I will do then is I will lubricate my catheter. I'm going to quickly just do this with the lubricant I need for my mannequin. You will not be breaking sterile technique. You will be placing at least 1 to 2 inches into the lubricant that you've already placed on your tray. And again, I will already have this hand in place. What I will do then is carefully lift the catheter out of the box, looping it around my hand and only having the first 1 to 2 inches exposed. I do not want to touch the catheter onto the drapes in case I have contaminated them. I will place the tip of the catheter straight into the meatus. I will ask the patient to bear down as if she is voiding, and I will insert the catheter slowly, rotating as necessary if I'm having a difficult time, until I see urine into the tubing. I will then insert 1 to 2 more inches for a female so that I make sure I have it in the proper place. What I will do then is take my syringe that I have attached to my balloon and I will insert all 10 cc's that are supplied so that I make sure I have proper balloon inflation. I pull back gently and I see that my catheter is remaining in place. What I will do then is proceed to use the StatLock securing device that is attached to my Foley catheter bag. That is also in a protective plastic covering.